Good morning, Sunrisers. I'm Dr. Karen Emerson, owner of Emerson Animal Hospital here in West Point, and I've got these girls with me again. We got Haley, my little girl, we got Molly, JC, their friends, and my little girl, Lily. But a special guest is Libby. Libby is an 8-year-old lab, and she presented about 3 or 4 months ago having coughing episodes, and we started Libby on antibiotics thinking she was having allergies, but the coughing continued. So then we decided to do a culture on Libby and do x-rays. The x-rays we're going to show you guys in a little bit so you can get an idea of how sick Libby was. Libby actually had bronchitis and pneumonia starting to form. So we went in and we cultured Libby's trachea to find out what bacteria was causing Libby to cough. So when your veterinarian asks you want to do a culture, or is it okay for them to do a culture if your pet's really sick, that is such an important thing to do because that allows us to isolate the bacteria that's making your pet sick so that we'll know what antibiotic to put your pet on. Because as you know, it's not safe just putting your pet on different antibiotics, seeing which one will work. That can cause resistance in bacteria. So Libby, we had to start doing actually injections with Libby once a day until she got well from this cough. And her bronchitis and pneumonia was getting so bad that it could have killed Libby. So without us taking immediate action, doing that culture, taking that x-ray, and educating that owner on what we needed to do to get Libby better, it could have been detrimental. So it is so important, guys, that if you have a pet, they're not getting well, they're not responding to antibiotics, please seek further medical assistance. All right, so this is an x-ray of Libby's chest just to show you the intensity of the bronchitis almost stemming into pneumonia. Right here we have Libby's trachea, we have Libby's heart. This is the lung fields of Libby. But as you can see, there's a lot of interstitial pattern in here. These are the little tree branches that go out into the lungs to oxygenate our lungs. And her little tree branches are full of mucus and just, they're very inflamed. So it's making it harder for Libby to move air in her lungs than normal. As you can see right here, we have an endome view of one of her tree branches, and right in here you see the outline of her lung. All of this is just a pattern, an interstitial pattern in her lungs indicating that Libby has got bronchitis and it could lead to pneumonia. So now Libby's feeling 100% better, she's doing great, and I promise your pets will thank you if you get the medical treatment they need. I hope you have a great week.
WCBI Animal Health with Dr. Emerson was brought to you by Emerson Animal Hospital in West Point.